Hi, I'm Jordan Berg. I am the director with the Telehealth Technology Assessment Center, or TTAC. In this short video presentation, I'm going to be doing a quick overview of broadband connectivity for telehealth, specifically focused on low Earth orbit satellite technology. We often call this LEO satellite technology. Um, our goal for the presentation today is not to present LEO technology as some sort of magical fix, but to really explain where it fits, what it can help with, and what healthcare organizations need to consider before relying on it for telehealth connectivity. Before we get too far, we should talk a little bit about who TTAC is. TTAC is federally funded through HRSA's Office for the Advancement of Telehealth, and we are the National Telehealth Technology Center within the Telehealth Resource Center program. Our role is to provide vendor-neutral technology assessment support, and that can include around technologies like telehealth platforms, devices, infrastructures, general connectivity, and other implementation considerations. We work in close partnership with the regional telehealth resource centers and the other national telehealth technology assessment, or the other national telehealth resource center. And you can reach us all through the National Consortium of Telehealth Resource Centers. So why are we talking about this? Why does it matter? Let's set the stage. Broadband is a key part of the care environment. When we have poor connectivity, it is an immediate impact on our ability to deliver telehealth. Our visits freeze, our audio drops, data that we need to support the visit is not uploaded and not accessible. We can't access the documentation and support that we need to make the visit go. It's also important to remember that for telehealth, we need more than basic internet access. We need connections that are stable, usable, and reliable. It's really important to remember, particularly for rural and hard to serve areas, where organizations may need layered options: terrestrial, where available, wireless, where it can be useful, and satellite, where we really need that connectivity. And then having backups for that connectivity is also important to maintain continuity of care. What do we need in a telehealth connection? What are we talking about? When people talk about broadband, they're often just focused on speed. Speed matters, but for telehealth and for healthcare in general, stability is job one. Bandwidth is a key part of the picture, but telehealth may require enough download and upload capacity for video, audio, other recordings, and connected devices. Latency and stability are just as important as speed. We want to make sure that we have low delay in our signal, low jitter, and minimum packet loss in order to make sure that our visits feel natural, reliable, and that we're communicating clearly. Supportability also matters. In healthcare, the question is not just whether a connection works on a good day, it's whether it happens when everything else is going wrong. Can it be installed? Can it be secured? Can it be monitored and restored when something is breaking? When we're talking about broadband and we're doing a comparison of the different options, we need to know, there are other options in the broadband space. We have terrestrial broadband, which includes fiber, cable, and DSL. Fiber is often the strongest long-term option where it is made available and can be affordable, but it can be expensive or slow to build out, particularly in rural areas. Wireless broadband includes fixed wireless and cellular. These extend reach, but performance is really going to depend on the coverage of those networks, what signal conditions look like, if there's congestion, and other considerations. So that brings us to satellite broadband, and this includes traditional geostationary, which we'll talk about in a moment, and low Earth orbit satellites. The main point here is there's probably not a single best answer. The best fit is going to depend on your care location, what the use case is, what you need in terms of reliability, and how much infrastructure you have to be able to support your needs. So what makes LEO different? So again, LEO stands for low Earth orbit. This is really the basic difference between these satellites and older internet satellites or older broadband satellites. It's a matter of distance. Traditional geostationary satellites are roughly 22,000 miles above the Earth. LEO satellites are much closer, often only 2 to 1,200 miles above the Earth. So that shorter signal path means that we have lower latency, and that can translate to better speeds. For telehealth, that matters because we use a lot of real-time communication, and our real-time communication is sensitive to delay. Lower latency means that Leo is very visible for video work, remote work, cloud-based tools, and other connected health workflows, more so than traditional geosynchronous or geostationary satellites. But a lower orbit does not automatically mean perfect performance. We're going to see actual variance depending on where the dish is located, what the sky view looks like, what the general network capacity is it congested or oversubscribed, what weather looks like in the area, how well the equipment's placed. We see a lot of variance in the plans, in many of the plans based on service tier and how those providers are supporting it. So the practical takeaway is really this. Leo can make satellite connectivity more useful and a lot more accessible for telehealth, but it still needs to be evaluated like any other connectivity option. Where might Leo fit in a telehealth program? So Leo fits best where traditional connectivity doesn't. It's where it's limited, unreliable, or unavailable. One use case is hard to serve sites, such as rural clinics, tribal health sites, and mobile care settings. Another is for backup and resilience. Leo may provide an alternate path during outages, disaster response, and network failures to traditional connectivity. A third use case is for mobile or temporary care, including maybe a community paramedicine program, a temporary clinic, emergency services, or other care outreach. Common thread that we want to underline here is that Leo is better. Is not that Leo is better than every other option. It's that Leo may be available where other options are limited, slow to deploy, or difficult to support. Let's talk a little bit about some of the clear strengths and cautions around using Leo. So, key strength, and we kind of hit this already, is that it provides much lower latency than traditional satellites. It can often be deployed much faster than new fiber, and it's useful for rural, mobile, and backup connectivity. Let's talk about a few of the cautions. Leo generally is going to require a clear view of the sky. If you've got a lot of trees, building, terrain, if your roof placement is not optimal, and weather, these can all affect the performance of the signal. Performance is going to vary based on location and the network congestion. So they send up large amounts of these satellites, but as more and more people subscribe to these programs, the network can become congested. It shouldn't be assumed that every site will have the same level of quality and experience with connectivity. Cost, support, security, and service tier are also going to really matter. These are the kind of practical nuts and bolts of actually just purchasing and using these tools. A consumer grade connection may work well for some uses, but for healthcare organizations, they're going to really want to look at the business or enterprise service models. That's going to give you more access to network security, better support expectations, and really look and see kind of plan how that connection is going to fit into existing operations. So again, key point here, Leo is useful, but it isn't magic. Another thing that we want to discuss is the shifting broadband policy around Leo. Leo is interesting because there's been a lot of movement in some of the broadband policy things that we've been following. Earlier broadband conversations in terms of increasing access have really focused on fiber first deployment wherever possible. And it made a lot of sense because fiber is durable, it's high capacity, it's really infrastructural change. A lot of recent federal broadband guidance has moved toward more technology neutral options. So it meant that we're less interested in how the technology is delivering the speed as long as it's able to deliver the connectivity and speed. So that means alternative technology, including fixed wireless, LEO satellites have more room in deployment decisions where they meet the basic program requirements for reliability and connectivity. So for healthcare, the question should remain the same. Does the connection support the care model we're trying to support? Location may can be considered served from a broadband mapping perspective, but healthcare organizations still need to ask whether the connection is stable enough, affordable enough, secure enough, supportable enough, and really adequate for the use case, that telehealth use case we're trying to support. So before we choose a connection, before we go down and start actually applying our funds to these, we need to start with that care model. Are you a clinic? Are you meeting with patients in their home? Are you deploying a mobile unit? Are you doing a community paramedicine program, a temporary care site, or a backup for existing connectivity? We need to define those connectivity requirements. Do you need video only? Do you need access to your electronic health record? Are you doing remote monitoring? Are you doing uploads from devices of medical data? Do you require secure staff communications like a secure chat? Are multiple users going to be using this connection at the same time? Only after you really have an understanding of those items should you choose the technology. If we start with technology first, and this is true for almost all technology decisions, but if we start with technology first, we risk choosing a tool, a connection that works technically, but does not really support what we're trying to do, the work that needs to happen. So I want to leave you with a couple takeaways, three key takeaways. First, we're going to start with the use case. Broadband decisions should follow the telehealth need. Second, we want to add Leo where it fits. It may be especially useful for rural, mobile, backup, and hard to serve settings. Third, we want to build in layered connectivity. We want to use terrestrial broadband where we can, wireless where it's useful, and satellite where we really need that connectivity. The goal isn't to just have faster internet. The goal is to provide more reliable care. And we want to build for continuity, not just for connectivity. And with that, we want to wrap up this conversation today. If you want more information about Leo or other telehealth technology, you can visit us at telehealthtechnology.org. We have a lot of free resources, and you can also connect with your telehealth resource center through the National Consortium website or through their regional telehealth resource center website. Thank you so much, and I hope this was a useful conversation for you.